Hi, it's Dr. Parasat from Omnia Health, and I want to talk about two really important gut health markers that we look at in our patients. So the first is stool calprotectin. Calprotectin is really a marker of really severe kind of inflammation that's going on in the gut. So a lot of times we use it as looking at, is this somebody who has maybe irritable bowel syndrome? So a normal healthy gut, but not functioning properly? Or is it somebody who has irritable bowel disease, Crohn's, colitis, celiac, or even cancer? So with the stool calprotectin being elevated, that's actually destruction of your colon cell itself. That's a really big deal. If you have elevated stool calprotectin, that's something that we highly recommend being followed with a GI doctor, looking at with a colonoscopy. We need to make sure that you're doing okay if this is up. Now, if that looks okay, one of the other markers we look at is zonulin. So stool zonulin is a marker of in between the cells. So a hyperpermeability marker, the proteins that link the two colon cells or link our colon cells. So when that gets stretched, broken, zonulin in the stool goes up. That protein is being released. And if we see an elevated zonulin, now of course those levels go up and down, but if they're really significantly elevated, we know that we're dealing with somebody who has GI hyperpermeability. This is known as layperson as AKA leaky gut. Not a term I love, but really is where if you have an elevated zonulin and you have that GI hyperpermeability, anything that's in that gut can leak out, especially endotoxins, viruses, bacteria, food proteins. Our immune system will activate to that and destruction can then follow. So it's two really important types of inflammation and inflammation proteins looking at that are very, very different and very important to understand the difference between, because there's different ways we address and heal the gut with both of those things. Thanks so much. Here at Omnia Health, we are dedicated to help you achieve your optimal health. And whether that's dealing with a chronic illness that you're just not getting the right answers for, or truly looking at your health for the first time and how you are set up for longevity, we are here to help you. So please follow us on Facebook and Instagram for more great tips and tricks, and hopefully we can serve you in the future. Thanks so much.